Prostate cancer is very common. It affects lots of males. And if you or your beloved ones were recently diagnosed with prostate cancer, first I'm going to say, I'm sorry for the diagnosis. It's a shock when you initially are diagnosed with prostate cancer. And that's why I'm creating this playlist and these videos to help patients and their families better understand their cancer and the treatment options. Okay. Who am I? My name is Ruben. I'm currently in training to become an oncologist and hematologist. And my goal from these videos is help to educate patients and make cancer simple for people. When you are first diagnosed with cancer, it's so overwhelming and it's so shocking. And I don't believe that the time that you spend with your healthcare provider, whether it's an oncologist or a general practitioner, it's enough to help you to go through that process. And this is why I'm creating those videos mainly to supplement the information that you get from your doctor or your nurse practitioner or your family doctor to help you better understand your cancer and the treatment options available. Disclaimer, these videos are not intended for medical advice. Please always talk to your oncologist or your family physician or the general practitioner, whoever is taking care of your cancer. Okay, so the first question is, what is prostate? What does this organ do? Okay, so the prostate is an organ that's mainly located just beneath the bladder. It secretes some fluid that is added to the semen and help to add nutrition to the sperm. That's one of the main functions. As you can see, it's also surrounding the urethra. So any enlargement in this organ can affect the urinary stream. It can cause difficulty initiating urine. It can cause dripping. It can cause feeling of incomplete sensation. Okay, so what are the symptoms of prostate cancer? Lots of times prostate cancer has no symptoms. It's diagnosed incidentally through one of the tests that we call prostatic specific antigens. And sometimes it can lead to symptoms because it is just around the urethra. It can compress on the urethra and, because it's just around the urethra, it can compress on the urethra and can lead to problems when passing urine, dribbling, and feeling of incomplete emptiness. And sometimes it can be in advanced stages where it can go to the bone. Bone is one of the favorite locations of the prostate cancer to travel to, and it can lead to bone pain. So as you can see, the range of symptoms goes from completely asymptomatic to causing significant pain. Okay. That being said, what are the treatment options? If you were diagnosed with prostate cancer, there are several treatment options. As you can see here, prostate cancer can sometimes be just observed. We divide prostate cancer into several risk categories. Low-risk prostate cancer and very low-risk prostate cancer can just be managed with observation, doing nothing, following up on you, seeing your physician, doing some imaging studies, doing measuring the prostatic specific antigen on a regular basis. Another option is radiation treatment. Whenever it comes to cancer, there are three types of physicians usually take care of cancer. Okay, we have the medical oncologist, the radiation oncologist, and the surgical oncologist. Medical oncologists are physicians who treat cancer via chemotherapy, hormonal therapy, and immunotherapy. Radiation oncologists, on the other hand, treat cancer with radiation. Those are big machines that usually can fire a radiation toward the cancer site, or in the case of prostate cancer, they can go and implant seeds in the prostate gland itself, and these seeds can expose the prostate for a certain amount of local radiation. On the other hand, we have the surgical oncologists. Surgical oncologists are the surgeons who do the prostatectomy or the surgery to remove the prostate gland. So those are the three main treatment options, either observation, radiation, or surgery. Also, we have hormonal therapy. The prostate gland is very sensitive to testosterone, which is a hormone that gives the male human its characteristics, its male human characteristics. So the prostate gland is very sensitive to this hormone. And with hormonal therapy, we can control testosterone production from the pituitary gland and testosterone effect on the prostate gland itself. And finally, we have the chemotherapy. Chemotherapy is a group of medications that can prevent cancer cells from dividing, and they can also, unfortunately, affect the normal body cells. Those are, in general, the treatment options for prostate cancer. In the future videos, we're going to go through details about each treatment options, what are the side effects and what are the indications, and that help you to go through your journey.